Hey, welcome to our first Your Utah Doulas Bump and Baby Chat. Thanks for everybody who submitted their questions and commented. Um, this is really exciting for us. We haven't tried something like this before, so hopefully we'll get a little more comfortable sitting in front of a live camera. So, to start off, um, just want to make sure that everyone's aware doulas are not medical providers. We are not midwives. We are not um, nurses. We are not OBs. And so if you have any medical questions, please ask your provider. That being said, we do know our way around some research. So let's see if we can get some of these questions answered. First question we had was, can a virus cause preterm labor? Right off the bat, we want to say, if you think that you're having preterm labor, please contact your medical provider immediately. Some signs and symptoms of preterm labor include change in vaginal discharge, increase in the amount of discharge, which is a change of it, pelvic or lower abdominal pressure, constant low, dull backache. I know that's hard because when you're pregnant, your back hurts a lot anyways, but this is a little different and it's constant. Mild abdominal cramps with or without diarrhea, and then regular or frequent contractions, uterine tightening, often painless, and then ruptured membranes. That's an easy one. Your water breaks. You need to call your doctor. So now that we've covered the signs of preterm labor and what to do, as to whether a virus can cause it, the American Journal of Reproductive Immunology released a article in 2015 called Viral Infections During Pregnancy, and I'll read you this little part from it right here. And it says, a viral infection can still lead to opportunistic infections that then can adversely affect the pregnancy. And we thought it was really interesting. The March of Dimes also has this information on their website, but it makes sense then why one of the reasons that providers get so worried when flu season hits with all their pregnant patients. So I wouldn't necessarily say that viruses cause preterm labor, but it does seem like there is some correlation that that can lead to opportunistic bacterial infections. So keep your hands clean, contact your doctors or your midwife if you notice any signs of preterm labor like we talked about earlier, and keep on top of your health. Make sure that you keep in close contact with your medical providers. Next, we have what do you think are the most important things to know for mom during the first 24 hours after giving birth? That was such a good question. Thank you for asking. The very first thing that happens after you give birth, after your baby is born, when we're talking vaginal birth at this moment, but vaginal birth, you're going to then deliver a placenta. Just in case you didn't know. That doesn't stay put, it comes out. So don't be alarmed if you haven't taken a childbirth class or done any sort of research or talked to your care provider about this. But after you give birth to the baby, then contractions will eventually start up again and you will give birth to the placenta. Next, we have the soft, empty belly. Some women have talked in the past about taking their pre-pregnancy pants with them to the hospital because they are so excited to be able to fit back in them. They're not pregnant anymore, right? Unfortunately, it takes a bit of time for the uterus to shrink back down. And so if you think about it, your uterus is usually very, very small, imperceptible. I mean, from somebody looking at you, they don't go, my, what a nice uterus you have. So knowing that, then it grows to roughly the size of a basketball to carry your baby. It's important to know that it's going to take time for that to go back down. So knowing that it goes back down also, you're going to be experiencing after pains. And so it's more common to experience those if you're breastfeeding or nursing, but you will get them regardless. But they're little uncomfortable contraction-like feelings, and it will slowly work to bring your uterus back out. You just know that it's working well. A warm heating pad can help, and just being patient. It won't last. This too shall pass. Then there's also soreness. So if you're feeling any sort of soreness, you can do a sitz bath or squirt bottle with warm water, ice packs, witch hazel, sit on a donut pillow. Make sure that when using ice, you talk to your care provider as well, because if there's any sort of tearing, you want to ask what their opinion is on how long you should be using ice. But then when we get to constipation, I'm really sorry. And this one especially is something that you deal with if you've had a cesarean. So if you're dealing with constipation afterwards, a lot of fiber, fluids, and you can ask your care provider for a laxative, and just take it easy on yourself. Let's see, what else have we got here? The lochia. Okay, so the lochia is like your period 2.0. So your body getting rid of everything that it was carrying to house baby. You're going to see a lot of blood. You're going to see some, what's it called? Anyway, if you notice, clots, blood clots as well. But make sure you talk to your provider about how much bleeding is normal, and what size of blood clots are okay, because the general rule of thumb, anything bigger than your fist is something you need to call the doctor about. And then as far as breastfeeding goes, a lot of women end up getting really nervous about breastfeeding early on because they're not providing a whole lot. The thing is breast milk isn't the first thing your breasts produce. It starts with colostrum. Seriously, colostrum. And it's referred to as liquid gold. It's specifically designed, your body specifically designs it for newborns, and they're very small tummies. We're talking like tiny. So a very little bit goes a long way. Your breast milk should actually come in about 4 days. And if it doesn't, you would definitely want to call a lactation consultant, but keep the number of one handy. We at your Utah doulas usually refer out to Lactation Link. They're local IBCLCs, and they're really top notch. We trust them with taking care of people. So, and then lastly are the hormone fluctuations, which can start pretty quickly. Be gentle with yourself, okay? Don't expect yourself to immediately have processed through everything, and don't put expectations on yourself like that, because you don't know what your hormones are going to do after you give birth, whether it's vaginally or surgically, whether it's medicated or unmedicated. You can respond to it in a numerous amount of ways. And so just take it easy on yourself. Know that postpartum, seriously, that cat. Know that postpartum depression, postpartum anxiety, symptoms and signs, be aware of them. Make sure that your partner's aware of them and they're helping to keep an eye on you, but also talk to a friend, because sometimes it's easy to forget what normal is when you're in the middle of things, and a friend who's aware of the situation can say, hey, it looks like you're really struggling. Why don't we take a look at some postpartum resources for this? And honestly, some women give birth and everything is just fine. So it's really a take it as it goes, but that's really what we're thinking are the most important things to be aware of in the next 24 hours. Oh, and lastly, swelling. Your care providers should talk to you about this. I can't think of any reason they wouldn't. But if you're noticing an increased amount of swelling to the point where it's worse than during pregnancy, then you need to contact them. But otherwise, keep your feet up and keep hydrated. And you'll especially see some swelling if you had a cesarean or any sort of fluids during birth. So the very last question we got was what to pack in a hospital bag. And it is, there's so many different things. So if we're going to talk about just for the labor, we're going to talk about a vaginal birth, and then we'll go to a cesarean, and then we'll talk about recovery. So a vaginal birth, what you want to take with you to the hospital, it also depends on if you're doing medicated or unmedicated. So make your birth plan, talk to your provider, talk to your facility, because sometimes the hospital has different policies than your doctor does. So make sure you have that clear. Snacks, high protein snacks, sugar every now and then. You know, it's a marathon, not a sprint, although some births will surprise you with that one, and they'll be over before you know it. But little bits of sugar, honey sticks are good for that extra dose. Something comfy, like a warm robe, a warm blanket, or even your own outfit. Some people really don't like laboring in hospital gowns, and that's okay. You're not required to wear them. They're nice because it's easy to get in and out of if you choose to get in a shower, or if you choose to get an epidural, any of those things. But honestly, a maxi dress is a really nice alternative. Easy access for your vaginal checks as well, and you wouldn't have to change out unless you chose to get an epidural. So comfortable clothing, hair ties, chapstick. They'll have water for you, but if you have a water bottle you like to bring that. Heating pad is nice as well. You can't bring anything that you would need to heat up on labor and deliveries microwave, in their microwave. So keep that in mind. So maybe if like one of those cold packs, or you break it and it heats up, or just really a heating pad is the easiest solution there. Let's see, things to make it feel more homey, a picture of your family, battery operated candles, and make sure to bring any medications you usually take. They'll have them on file, but you'll still want to bring them in just to double check and verify that they have the right information and that you're using them. You can ask if they have birth balls. I can't think of a single Utah hospital that doesn't have birth balls or peanut balls. So, but like I said, it's easy to just call ahead and ask. The labor and delivery nurses at every hospital are so wonderful. They'll answer your questions. The only thing they can't do is diagnose you with anything over the phone. So if you're wondering if your water broke and if you should come in and your doctor said to call the hospital, you kind of just have to go in instead of trying to answer that over the phone. Then when we're talking cesarean birth, C-sections, you'll want any music you might want to listen to. There are some really wonderful anesthesiologists who will ask what you want to listen to and put Pandora on their phones. I really have appreciated working with them. Then, but you want to be prepared for yourself. So if there's any sort of music you want, if you would rather have a personal blanket on top of what they put on you in the OR, have that. Let's see, camera for pictures, video. Again, ask if it's allowed, and most of them would allow video, but you're dealing with people in the OR. So if the general rule of thumb, if it's something that's happening from the waist down, your OB is in charge, and if it's something happening from the waist up, your anesthesiologist is in charge. So it also helps if it's a scheduled cesarean to find out who the anesthesiologist is on call. Then as far as recovery and mother-baby, you'll want comfy pajamas, maybe a robe, slippers, your shower products, anything to keep you busy. If it's a vaginal birth, you're going to be there for 2 days. If it's a cesarean, you're there for 4 days. So think of anything you might want. You'll want snacks. The nurse's station only has crackers, cookies, and juices. And so they'll deliver meals 3 times a day. But if you're hungry, and especially if you're breastfeeding, you burn up so many calories that way. You'll want to pack your own snacks, or here's a trick I learned: you order a lot of extra sides with your meals. And so they can't bring food to you in between the meals, but they can pack on the sides. So just order on the sides and be able to pick from that throughout the day. You'll want to be doing a lot of skin to skin with your baby. So warm blankets for both of you, and then any clothes you want your baby to wear. They'll only have those onesies that you see in newborn photos and movies that show hospital birth. So, but your room will have a thermostat. So if you want to spend most of your time doing skin to skin with your baby, just keep the room comfortable and put a fuzzy blanket on. But yeah, oh, and car seat. They won't let you leave without it. So if you have any more questions, feel free to post them in the comments and we'll save them for next week. And thanks for watching our first live video. I think it went great. Let us know how it went. See you later.